Hi guys, it's Doc Janelle. Welcome back to my channel. The subject at hand is community and public health, and we'll be talking about the fifth topic, the Philippine Health Agenda. So from the time that President Duterte started his administration, he also published his Philippine Health Agenda, which will run for for 6 years. And the title of his Philippine Health Agenda is All for Health Towards Health for All. So a National Health Summit was held in September 15, 2016 at PICC, and the summit endeavored to strengthen partnerships to achieve all for health towards health for all. So this is the title of the Philippine Health Agenda of the Duterte administration. And in this agenda, he challenged DOH to boldly take on the challenge to be able to guarantee that all Filipinos will receive optimal health care in all stages of their lives, that the DOH will be able to address the different diseases which are rampant in the country. And as we discuss this, we'll be able to see what the program is about and why the program is the way that it is. So first, I want to share with you the 3 goals of the Philippine Health Agenda. Please do memorize this. Number 1, they want to make sure that Filipinos have financial protection. As seen in the slide, Filipinos, especially the poor, the marginalized, and the vulnerable, are protected from the high cost of healthcare. So it's very apparent that healthcare in the Philippines is more of a privilege rather than a basic human right. It is something that is only accessible and can only be enjoyed by people who have the resources to actually seek medical attention. Unfortunately, for most of the Filipinos who are living under and even above the poverty line, healthcare doesn't seem to be a priority for them. Second, the goal of the agenda is to provide better health outcomes. So they want to make sure that when Filipinos go to hospitals and RHUs and primary care clinics, they will be taken care of and they will be given the best possible healthcare delivery. The last is responsiveness. So the agenda wants to make sure that Filipinos feel respected, valued, and empowered in all of their interaction with the health system. So it cannot be denied that a lot of Filipinos also put healthcare at a lower priority because their experience in our healthcare system is not pleasurable. Napapagalitan sila, nasisigawan sila, nasusungitan sila by doctors and nurses and secretaries and people generally working in the healthcare system. So the agenda also wants to change that kind of approach. And how do the agenda wants to do it? Through these following values. Number 1, it wants to provide equitable and inclusive care for everybody, no matter the gender, no matter the age, no matter the financial capacity. The service given should be equal. Second, through transparency and accountability. The government wants to make sure that from the top government down to the people working in the grassroots, all services are actually transparent and accountable. They want to make sure that resources are used efficiently, and that even if you are just working or even if you are seeking medical attention from a simple clinic, from a simple primary healthcare unit, no, from a barangay health center, they want to make sure that you are provided with a high quality of service. So there are actually been a lot of changes already in the healthcare system of the country. No, from the time when DOH was first established in 1947, ang dami na naging improvements. And these are some of them. First is devolution. I already mentioned this in our previous topics, no? Empowering, giving power and authority to the local government units to actually really finance, hire, and provide the best care possible to their people. We also passed a law providing support on the use of generics. We also have a law supporting breastfeeding for infants less than 2 years old, and that is the Milk Code. In 1995, the PhilHealth, or the National Health Insurance Program of the country, was passed into law. The DOH resources also promote local health system development. They provide trainings and a lot of webinars in order to keep all barangay health workers, all doctors, all nurses at par with each other and with the international standards. They also gave fiscal autonomy for government hospitals. What do we mean by this? Fiscal autonomy. It is the separation of powers of political agencies and the hospitals. Meaning, yes, DOH still manages the government hospitals per se, but the allocation of budget, the use of budget, the hiring of personnel, they are all under the government administration, not DOH anymore. We also provided good governance programs to make sure that there is a check and balance amongst our government, including ISO, IMC, and PGS. And of course, last but not the least, the funding for our UHC or the Universal Health Care. However, with all these milestones and all these improvements, there are still persisting inequities in our health outcomes. Every year, around 2,000 mothers still die due to pregnancy-related complications, despite the efforts of the MDGs to push for maternal health, despite the rampant health promotion and health education being provided for the government about proper maternal care and childbirth, still 2,000 mothers fall prey to these pregnancy-related complications, no? A Filipino child born to the poorest family is 3 times more likely not to reach his 5th birthday compared to somebody who was probably born from a resourced family, no? So, 3 out of 10 children are malnourished, specifically stunted. Moreover, there have been several criticisms about our public clinics and hospitals, specifically the long wait times, no? Even if you need urgent care, urgent attention, you still have to wait for your turn, mainly because there are only the manpower is very much is very low in the country. We have limited autonomy to choose provider, no? Usually when you go to public hospitals, you are assigned a random doctor. You do not have the freedom to choose which doctor you want to see. The restrooms and the amenities are less than hygienic. In fact, when you go to public hospitals, public or government hospitals, you would not want to stay there yourselves. No, so yung facilities talaga very poor. Privacy and confidentiality is taken lightly because patients share a bed. In the operating room, 2 patients are being operated at the same time, no? So there is no more privacy and confidentiality. There is poor record keeping, and there is overcrowding and under provision of care, no? As I said, I still remember when I interned at East Avenue Medical Centers, 2 or 3 babies would share the same bed. Imagine that. And of course, there is still restrictive and impoverishing healthcare costs. As mentioned, healthcare is still a privilege rather than a basic human right. Every year, 1.5 million Filipinos are pushed to poverty due to healthcare expenditures. And because of this, the fear of going poor, the fear of poverty, Filipinos then forgo or delay care due to prohibitive and unpredictable user fees or co-payments, no? When they go to government hospitals and private hospitals, nagugulat sila kasi ang mahal-mahal ng singil sa kanila. And imbes na gumaling sila, lalo silang nasa stress because nagpapatong-patong ang utang. So the next time that they need medical care, they do not go anymore. Tinitiis na lang nila. And an average amount of 4,000 pesos spent on healthcare a month can be considered catastrophic already for families with only a single breadwinner. So these are real-time problems that is happening even up until now. And so the government wanted to provide a solution to all of these problems. And these solutions that they think should be able to eventually attain the health-related SDG targets. So here is the Philippine Health Agenda Framework. There are 7 strategies under the Philippine Health Agenda. And these strategies are represented by the acronym ACHIEVE, ACHIEVE. And those strategies should be able to address or reach the three guarantees of the Philippine Health Agenda, which we will discuss later on. And these guarantees should be able to satisfy the goals and the values, and eventually, through achieving all of this, we'll be able to attain our SDGs. So now let's talk about the three guarantees of the Philippine Health Agenda. First is all life stages and triple burden of disease. Guarantee 1 wants to provide intervention, wants to provide programs, wants to provide laws and provisions to make sure that all life stages will have health promotion and wellness. That from pregnancy to elderly, from womb to tomb, there are already programs in place to prevent and treat their diseases, to facilitate rehabilitation, provide palliation, facilitate delay complications in any sickness in all life stages. So here you can see the list of programs present or currently being implemented by the Philippine Health Agenda. So from the first 1,000 days to the presence of reproductive and sexual health, maternal, newborn, and child health programs, breastfeeding, nutrition, immunization, etc. No? And also, the guarantee wants to make sure that the DOH addresses the triple burden of disease. What is this triple burden of disease? These are the three groups of diseases that has been rampant in the country. Specifically, communicable diseases, non-communicable diseases and malnutrition, and the diseases of rapid urbanization and industrialization. Let me give you some diseases to be under each burden. So communicable diseases include HIV, AIDS, tuberculosis, and malaria. Those diseases for elimination like dengue, leptospirosis, Ebola, and Zika virus. No, these are only some of them. The non-communicable diseases include cancer, diabetes, heart diseases, and the risk factors such as smoking, obesity, diet, and sedentary lifestyle, and of course, malnutrition. For diseases of rapid urbanization, we have road injuries, no? Dami nasasagasaan because of rapid urbanization. Residential areas are being turned into commercial areas, no? Substance abuse, mental illness, pandemics, travel medicine, and the health consequences brought about by disasters and climate change. So please do try to be familiar with the diseases under each burden. You might be asked to classify them. Second guarantee is to provide better service delivery network. So the government wants to make sure that all government facilities, all healthcare facilities are fully functional. No, from the facilities, from the equipment to the healthcare workers, they should be able to provide quality services to Filipinos. More than that, the government wants to make sure that our doctors, our hospitals are compliant with clinical practice guidelines. When we say clinical practice guidelines, this is the international standard of treating and managing diseases. Meaning, we have a clinical practice guidelines, let's say for pneumonia. There is a recommended antibiotic. There is a criteria when to admit a patient, when to do a certain operation or test on a patient. Thus, if there is a CPG guiding everybody, doctors will not be able to abuse the system, nor will they be able to provide subpar or unsatisfactory service or healthcare to our patients. Number 3, they made sure that 911 is available 24/7, especially during disasters. Practicing gatekeeping, I already mentioned this in our previous topic, no? That each family will be assigned a family physician or a primary care physician. And before these families or patients can go to specialists, they must first see their family physicians, no? Next is making sure that these services are located close to the people, or if not, there should be mobile clinics available. And lastly, the start of telemedicine. So even before the pandemic, the country has been venturing out into the possibility of telemedicine. The third guarantee is universal health insurance. And this is very important, no? Because the services should be financed predominantly by PhilHealth, no? So now the country is gearing towards making the healthcare system available for all, and not only that, free for all. So the PhilHealth is the gateway to free, affordable care. Now, under the Universal Healthcare Law, 100% of Filipinos are automatic members of PhilHealth. Before, you have to be employed, elderly, poor, person with disability, women or children before you can be a member of PhilHealth. But now, no matter the age, no matter the employment, no matter the geographic area, you are an automatic member of PhilHealth. So, the formal sector or the employed sector contribute to PhilHealth by paying or by having deductions in their payroll. So, pag sahod ng mga employees natin or lahat ng nasa employed sector, automatic kinakalta sa sahod nila yung contribution nila para may pondo ang PhilHealth. And for the non-formal sector, children, for the people with disability who are not employed, the elderly, no, the indigenous who cannot contribute through premiums or through their payroll, yung contributions nila kinukuha natin through tax subsidy. No? So from the tax ng bayan natin. Number 2, they simplified PhilHealth rules. So no balance billing and fixed co-payment na po tayo. When we say balance billing, no, usually when you go to a hospital, there is a fee. Let's say for childbirth. Sabihin nila, childbirth in this hospital costs 30,000 pesos. However, PhilHealth will only cover 15,000 pesos. Yung no balance billing will ensure that you will not be charged anymore with the balance. So, PhilHealth will cover not only 15,000 pesos but the rest of the bill being charged for you. Yung fixed co-payment naman is it is the negotiated fixed amount for quality care that may be charged by the hospital approved by the corporation. Meaning, pag sinabi ng PhilHealth na all childbirths all over the country should only be charged 30,000 pesos, finifix na niya lahat yon. Gusto niya uniform lahat para no balance billing na tayo. Okay? Third is PhilHealth as main revenue source for public healthcare providers. So, the services may be free, but what if the services are limited? So PhilHealth also made sure that they expanded the benefits, they expanded the range of services, and networks are made in between the system. So how do they plan to achieve the 3 guarantees? No, as you saw in the framework earlier, the strategies will be the ones to contribute to the achievement of the 3 guarantees. They want to do it through advanced quality health promotion and primary care, covering all Filipinos against health-related financial risk, no, thus the no balance billing and fixed co-payment. They want to harness the power of strategic human resource of health development, meaning yung hiring ng mga healthcare professionals natin. Gusto nila everybody will get an equal chance. Walang palakasan system, walang backer, no? They want to invest in e-health to make sure that all electronic medical records are now online. So if you're from Cebu, going to be operated in Manila, your records does not need to be flown into Manila. Everything is just digital, everything is online. They want to enforce standards, accountability, and transparency. They want to value all clients, patients, especially the poor, the marginalized, and vulnerable. That even if you are indigenous, you are treated the same way as a rich patient. There is no room difference. There is no difference in the treatment. And lastly, to elicit multi-sectoral and multi-stakeholder support for health. So making sure that more private entities actually contribute to the PhilHealth Fund. So, through the Achieve strategy, if we are able to do all seven, then the three guarantees will be achieved. And if we are able to really provide better service delivery network, really provide programs to last all life stages and address the triple burden of disease, and if you'll be able to provide ample amount of budget for the universal health insurance, then we'll be able to attain the health-related SDGs or SDG number 3. So again, the goal is to provide financial risk protection, better health outcomes, and responsiveness. That's the end of our topic of the Philippine Health Agenda. Hope you learned something. Shalom.